Good morning, everyone. Can everyone hear me okay? Thanks for joining us today and joining us for the Arts and Physical Healing session. I'm Andrika. I'll be your moderator for this session. Today we have with us Dr. Catherine Bevan, Doctor of Obstetrics and Gynecology, Professor Deborah Naff, or Debbie Naff Dacus. She has a private practice in music therapy. Stacy Birst-Yates. She's an art therapist, a licensed professional counselor, and an artist. We have Dr. Stephen Fung, Assistant Professor of Family Medicine and Osteopathic Manipulative Medicine, Texas College of Osteopathic Medicine, and also Dr. James Ashton, Family Medicine, Osteopathic Manipulative Medicine, Performing Arts Medicine. And again, I'm going to be your moderator for this session. I work with Texas Health Community Hope as the Community Engagement Program Manager, and in that division, Community Hope, we really focus on really the best way to say it is improving health beyond the hospital walls. When you think of a hospital, you think of the patients on the different floors, but we focus on community health and well-being and really work with different community leaders and organizations to improve holistic health and well-being. And so recently, I had the opportunity with Arts Fort Worth to participate in the Arts for Everybody convening. And there were many artists and health practitioners, community leaders, experts, and people from all over different fields coming together to hear updates in the art world, but most importantly talk about some of the groundbreaking research happening around the intersection of arts and health. And so one of the takeaways that leans into today's panel was the growing body of evidence that we're seeing when it comes to arts and physical health, or arts and healing overall. Looking at how arts helps improve well-being, but most importantly, how art is a driver for health. So, with that said, we are going to go ahead and get it started to hear more from our amazing panel that we have today. And so, the first person we have up is Dr. Catherine Bevan.
Hey, thanks for having me.
So, we're going to share a mic, but can you still hear me? Okay. So, the first question I have for you is, can you share examples of how you've seen art impact the physical health of your patients?
Yes, absolutely. I see this a lot as an obstetric gynecologist, because our patients, we see them over the whole span of their life and for a lot of really traumatic things, right? So art and healing really provide them a way to escape from some of their issues, but also process those issues. And I'll give you an example, first of all, with our cancer patients. And we deal a lot with, uterine, ovarian, colon cancer, cervical cancer, all those things. These treatments are very, very hard on the body and the mind, and require a lot of chemotherapy, radiation, surgery, and having an outlet for them to not only express those feelings and be able to um, process what they're going through is so important. And art therapy, music, journaling, I mean, all those things really allow them to tap into kind of a different part of their brain that kind of helps them just really, again, processing and understanding what they're going through a lot better. It also is wonderful as a connection to the community. Anything that allows them to participate in arts beyond what they're going through and with their groups of fellow cancer patients is wonderful. The other thing too that we do see a lot is in our obstetric population. We know that high stress levels in pregnancy can lead to poor pregnancy outcomes, especially in that third trimester. And when you get high cortisol levels, when you get a lot of stress, you can see more preterm birth and low birth weight infants. And so being able to participate in programs like belly casting or again journaling, art therapy, things like that will give them better outcomes.
Thank you so much for sharing. The next question we have is for Dr. Fung. Can you tell us about HSC's Performing Arts Medicine program?
Yeah, so HSC medicine program started in 1999, but under a different name. It's the Texas Center of Music and Medicine. So that was partnered with UNT Denton's music department, where they did a lot of research. And one of the main one was the sound safety, which is now part of NIOSH, and hearing health, and making sure that our musicians, our dancers, and the public are aware of the how dangerous sounds can be, and depending on how music is involved with that too. Because a lot of concerts, they blast everything on full volume, and all of a sudden, oh, I can't hear something, right? So putting those safety precautions are important. And then in 2014, Dr. Survey came on board with Dr. Chris Chesky, and they're saying, oh, well, it's more than music, it's also dance, actors, backstage crew members. So they've changed it to the Texas Center of Performing Arts and Health. And then through that came the HSC Performing Arts Medicine Fellowship, which Dr. Aston is the first class to graduate from that in 2019. And we all know what happened there. So there was a brief hiatus between that COVID. And so I was the second class going in. And through that, we've been able to get a weekly clinic for underinsured or non-insured artists, and those involved with the arts, so that they can get care, so that we can address them in their physical health to allow them to pursue their passion in the arts.
At the moment. Am I good now? Okay, perfect. Perfect timing. And so, and how do they find you in that program?
How do they find us? So online is usually one. The other one is we also, through this program, it's an educational with our fellows as well. So they go out to local music educators. Like we partnered up with a local guitar studio. We've been to multiple dance studios as well. We're currently we've done lectures at UNT Denton's music department, Dallas Symphony, Texas Ballet Theater, and other local theaters around. So there's that. We have an attending who is active on Instagram, so that's how they get plugged in. And we kind of do our best to advertise as much as we can and talk to um, you guys here and say, hey, if someone who doesn't have insurance or is underinsured, where they have a very high copayment, then they can come see us for free, and that's through the grant, through the RIA Charitable Trust. I think that's what it's called. Yes.
Thank you. And so, moving forward with Dr. Aston, there's a growing body of research that shows how the arts improves our physical health. But sometimes the demands of being a working professional artist can take a physical toll. Can you tell us about the different ways the performing arts can affect our bodies for better or for worse?
Certainly. You know, I'm a primary care doc, and prevention is the name of the game if you really want to keep people healthy. We know that between 10 to 15% of Americans have diabetes, and 30% have metabolic syndrome, which is a precursor for diabetes. But we also know that patients who regularly attend the arts, whatever those arts may be, have lower rates of diabetes. Dr. Bevan mentioned cortisol and the increased stress of life. And I believe that participation in the arts, whether that be creating the arts or enjoying the arts, reduces cortisol levels in particular. And so we see a huge value in the community for having arts in the community for the health of the community. But the difficulty we face is, what do we do for the artists? As Dr. Fung mentioned, many performing artists are underinsured or uninsured. 40% of professional performing artists in this country have no insurance. And the average salary for a professional performing artist in the United States is $45,000 a year. The average salary for a dancer is just over $30,000 a year. So it makes it difficult to get access. So we have programs to do that. But getting the word out is also important because you know what it's like to be a creative. Who's got time in their schedule to break off from practice to go to the doctor? To break off from doing your painting or doing your pottery to go to the doctor? And so we have to make it more accessible, and that's exactly what we're trying to do. But the overall benefit to the community, both the creative community and to the community in general, is undeniable.
Thank you so much. And so, Debbie, in what ways do you believe music can facilitate healing in physical ailments or chronic conditions?
I love this question. I love my job. First of all, if you were here in the last session, Heather already sort of led the witness here. Please do me a favor. I'm doing my little advocacy for a minute. If you want to work with a music therapist, please make sure that it is someone that is board certified. It will say MTBC after their name. That means that they went to a university approved program where they had to study psychology of music, they had anatomy and physiology. I'm a neuro nerd. I love to learn about the brain. All of those things. How does the psychology of music affect us? All of those things are very important. We don't want to do harm. We don't want to blast music at you, as Dr. Fung was just talking about. We also don't want to play music for you that's going to increase your anxiety, that is going to increase your heart rate, and many of the things Dr. Aston was talking about. We want to help you. So make sure, just like you choose your doctor, make sure that you are getting the best music therapist you can. And it's not easy to get board certified. And at the time when I was a student, I didn't like that. Now I'm delighted that I can tell you that it takes time and effort. And so I do what I do because I truly believe in it and love it. My particular specialization is folks of varying ages with varying abilities. And so it is my job to come to them. A big part of the difference in being just a musician, I say that with love because I was just a musician for many, many years. I sang professionally for more years than I'm going to tell you. And it really informed my work as a music therapist. So I am not poo pooing that. But I am saying, as a music therapist, we have goals and objectives that we design, and we manipulate our tools, which is the rhythm and the structure and the melody of music, to have a positive effect on whatever that person is needing. What if they're recovering from surgery? They can't move their arms very well. Well, when you're working with kiddos, that's really, really scary. I had the joy of working in a multi-treatment day clinic when I first started as a music therapist and got to learn from these extraordinary therapists in the other disciplines. And it was so cute. We would really use each other. If I ever had a break in my schedule, I would hear someone yelling to me in the gym going, "Debbie, bring your guitar and come down here." Because they would have some kiddo who was weeping because they needed to get some very important physical therapy, but they were frightened. So not only could I redirect what was happening, I could also aid in manipulating the child in whatever way they needed to. So the engagement of music is global. This is what's exciting. Music stimulus is one of the few things that we have that affects us neurologically globally. Why is that important? What happens if you have an injury? I have a young man in my practice who had a left hemispherectomy when he was 2 years old. They don't even do that anymore. But he is the result of that. They told me he would never walk, he would never talk, he would never do all of these different things. Okay, the best thing you can do is tell me that somebody can't do something. So I think music is magic when you have trained to use it and manipulate it for your purposes. So I'm happy to tell you this young man is walking, thank you very much, into my house to come and do his lessons. Not everyone can understand what he's saying, but he definitely has his opinions about things and shares them with us. And he does have words that you can understand. So the joy, I think, of what we do is, as the others have said, there are so many ways that the therapeutic disciplines and our mutual interventions can reinforce, redirect, increase all of these goals and objectives that we have for our clients, patients, students.
Thank you. Stacy, how have you seen art therapy help individuals manage pain or discomfort related to physical health issues?
I've seen that demonstrated in rehab facilities, excuse me, and hospitals. I also did some work with a local nonprofit organization called uh, North Texas Community Texas. I'm so sorry. I'm so nervous. It was a cancer organization, and so what we could offer them were art experiences that would allow for them to come outside of their pain by driving their attentions and their creativities towards, maybe it would be color or movement or line or mark making, taking them outside of their maybe focus or concentrations on pain and giving them an experience that allowed for them to kind of lose themselves in a creative experience, be it painting or drawing or play. So from a place of pain management, the arts are a wonderful tool for us to be using. Also for individuals, not only physical pain, but there's mental and emotional pain like we spoke of in the previous panel. And so it really marries both our emotional, psychological, and physical pain challenges that we're having. It gives us an opportunity to come outside of maybe all of the racing thoughts that we're having and redirect our attentions towards something that is very pleasurable and also actually very informative as well.
Thank you. So next, Dr. Ashton, I understand that you sing in a choir of HSC doctors and faculty. And apparently, you recently performed a holiday concert with the Fort Worth Medical Orchestra. Is it a coincidence that you and so many other doctors make art, or do you think there is more to it?
You know, it never ceases to surprise me how many physicians, and you know, there's 3 of us on the panel today who are performers. And I think there's a direct connection between our wanting to express our emotions through our music and wanting to help our communities. And, you know, I see myself as a physician as both a teacher, but also a healer. And that ability of the arts to heal goes hand in hand. So with what we do, so it makes sense that we all want to heal in more than just ways of giving medications, but wanting to heal through other means. And it's also very rewarding. I enjoy it. It's nice to be able to get away from the clinic and sing a little bit. And I train medical residents. They will tell you I sing in the clinic too.
Thank you. Catherine, Dr. Bevan, how does participating in artistic activities contribute to stress reduction and its associated physical health benefits?
Well, I'll also just echo your sentiments as well. I think personally, as a physician, the arts have been truly life-changing for me. Physicians and other medical professionals have so much burnout. There's so much required of us all the time, and we grew up in an atmosphere of like, say yes to everything and sacrifice everything, and then you'll be good. So allowing art in your space and as part of your life is incredibly important for the longevity of your career and not only your health, but also your patient's health too, right? If you're burnout, you're not going to provide as good a care. So I'll just say that, yes, I love that so much. And broadly speaking though, as far as the benefits of art and medicine as far as like the patient goes as well, or and myself being a patient too. We see really a lot of activation in the parasympathetic nervous system, especially here in the U.S. We are so just on all the time. Our stress levels are high. We talked about cortisol already, and we just kind of live a lot in the sympathetic nervous system where we're just fight or flight mode, right? Art really allows us to get into kind of the other space, rest and digest, right? So we can process our emotions better. We can take time for ourselves. I feel like, when I'm painting or dancing, I am using a completely different part of my brain. And that's so important for patients as well. And the other thing too that I think we have seen more and more research is going to is the neuroplasticity of our brains. If we are telling ourselves constantly degrading, demeaning things, stress things, that's where our brain's going to go. Art, music, all those creative endeavors allow our brain to expand, look at different things, be more positive, and engage culturally in things that we may not be able to if we're so stuck in one point of view. So,
Thank you. And Stacy, how do you incorporate cultural perspectives on health and healing into the art therapy practices?
It's very much meeting patients, clients, where they're at, their families of origin, their belief systems. I tend to do a lot of work with fabrics, asking I'm going to call them artists, to come in and incorporate things from their home, their family, their culture that is significant or important to them. I do a lot of work with weaving or wrappings where materials that, again, are very important to them. Maybe they were their great grandmothers and there's this little piece of thread or a piece of a blanket. And it provides an opportunity for them to share in their experiences, not just visually, but also to be talking about, remembering, further processing, et cetera. I can do a lot of work with vision boards where, again, I'm asking the artist to bring in materials or things from their home that speak to them as an individual and their culture, their family of origin, to set goals or to look upon building on values and whatnot. And it's really meeting all of our artists where they are and honoring who they are as a authentic individual. And anytime that we can bring them or have them engaging with more of their self and their culture, the more meaningful sometimes these pieces can be.
Thank you. And Debbie, how do you collaborate with medical professionals to integrate art therapy into comprehensive healthcare plans?
Yes, if I could, I just want to say something about Dr. Bevan's comment about neuroplasticity. I am a walking, talking illustration of that. I had a stroke, a CVA, in 2015, and I'm great. I'm one of the lucky ones. Statistics aren't good, so I feel very, very, very fortunate. I'm able to do everything that I did before. And it's a wonderful excuse too as I get older when I can't remember something. I had a stroke, so I can't remember that. But the neuroplasticity piece is so important for us to remember when we're talking about the arts. My sweet husband, not very long after the stroke, I was still in the hospital. The nurse was asking me a question, and I couldn't understand her. And my sweet husband says, "Sing it to her." And she sang it to me. First of all, yay for that nurse. She was not afraid at all. She couldn't sing her way out of a paper bag. Didn't matter. Didn't matter. She sang it to me, and my brain understood that, and I was able to make some sort of answer to her. So I am here to just tell you, yes, it's very much, it works. I was so lucky when I first started as a music therapist, I had a friend who was a chaplain at Cook's Children's, and he introduced me to a couple of pediatric neurologists. They put me through my paces. I started in 1987, and people were just figuring out how the two words music and therapy went together, let alone what we did. And so it was good for me. I had to educate and advocate for myself, and it was a wonderful experience. To have to learn to do that and do it specifically for them. Try to learn that terminology, try to help them understand neurologically what I would try to do to help. So these wonderful pediatric neurologists fell for it hook, line, and sinker, thank goodness. And so they would write prescriptions. And that's sort of how my practice started. So we talked about the fact that yes, music is wonderful. It's a wonderful thing to listen to. It can bring us great joy. It can also really irritate us if it is not the right music. And as a board certified music therapist, I should be able to make those adjustments for any patient that comes into my practice. And I was going to say something else and it just went away. Okay, see, I'll blame it on my CVA. It's a stroke.
Yeah.
Dr. Essen said it was a stroke.
A stroke is good luck.
Yeah. Oh, yes. So, thank you. You helped me remember. So, once that got rolling, you know what it's like if you've ever been in the school districts. When an administrator sees that that school has something that they don't have, they want it, right? So once these neurologists started talking about it and saying, I have these kiddos in my practice, for example, that they were struggling finding resources for the families. They weren't sure, quite frankly, what the outcomes might be for some of these people. It couldn't hurt to send them to me. The good news is we were able to be useful, to be helpful. And when you think about the different types of tools that I have as a music therapist, I have instruments where people have to be able to lift, where they have to be able to cross midline, where they have to use things bilaterally, where they have to do two things at once. When you beat a drum, you're holding it and beating it at the same time. All of those things are extremely useful. The kiddos think they're just having fun, that they're just playing. But they're doing some really important and in some cases really difficult work when they do those things. When you do movement songs and you have to move your legs side to side or up and down, all of those things are reinforcing what those neurologists wanted me to work on. And then I would do my own observation and assessment and see what else perhaps that I could take out of my toolkit and help this child develop, excuse me, to the best of their ability. And then I get such generous information too from the parents and the information that they have been given by their medical community. What else could I work on? So it is a myriad of ways. This is why I love my job. It is never, ever dull. I do something different with each person that walks in my door.
Thank you. And last, we have Dr. Fung. Are there any research studies or evidence that support the benefits of art therapy on physical health that you would recommend?
Oh yes, there's a lot. There's everywhere you look, the more we're interested in research, the more people are doing it. And so I think in the previous session they were talking about we need more numbers. And so I think there was a 2023 meta-analysis. So a meta-analysis is like accumulation of all research that has been there related to one topic. So it kind of gives like, hey, instead of just doing it on 30 people, can we see what happens with 300 people, 600 people, things like that. And they've done lots of studies with cancer patients, stroke patients, and there's one that Montreal Mona, they did their research with just like normal elderly people, and they've noticed that they had improvements in decreased frailty, so it improved their heart rate, improved their strength, decreased fall risk, and that's just going to the museum once a week. So I'm like, hey, if it's good enough for normal people, I think we should all do that too. And, you get not only, and it's like distracting them from all the steps that they're taking, sitting down, standing up, all of that requires muscles. and that also strengthens their muscles as well. At the same time, you're looking at amazing artwork too. So there's a lot of research out there. Google Scholar has a lot. If you just like Google in, visual arts, especially with dance. For my practice, I do a lot of rehab, and and with my background in ballet, I use a lot of ballet exercises to strengthen ankles, strengthen the feet. Because I noticed that because of COVID, a lot of people sat down all day and their feet started getting weak, and they're like, Dr. Fong, how come my knee hurts? How come my hip hurts? How come my feet hurts? I was like, well, you've been sitting for 4 years. You haven't used your feet in a while. We got to wake them up. So, and they're like, oh, I did those exercises and now my knee pain went away. I'm like, yeah, because you just haven't used them in a while. So there's lots and lots of evidence in the arts. Yeah.
And if you don't mind me just interjecting, our music therapy website, musictherapy.org, if you go into that left column, when you get onto the website, it has fact sheets after fact sheets after fact sheets that give research, lists of research, evidence-based research that has been done for us to show that it's not just because I love it. There are really reasons that this works.
Oh, and I forgot to mention, there's also like a big organization, Dance for Parkinson's, and they have a lot of research on how big motions and you see it too, like when they're in dance, they're moving and they're doing great the moment they step out the door, and then they start tremoring and everything. So it's a very interesting, it's like you have the potential of motion, and it's just how do we connect it to real world experience and everything like that.
Well, thank you all for having us. We are sticking close to time. So if you have questions for them, take a mental snapshot of what their faces look like and find them in this room or floating around. So today we've heard a lot about how art can help with things like stress, self-care, and just really growing our or using our brains to grow new connections with neuroplasticity. So I hope from what you heard today, it sparked some new ideas, potential collaborations, but really thinking more about how you can incorporate arts into healing and health. So let's give a round of applause to our panelists. Thank you all for joining us for this session, and this is a moment for a break.